Well, hello there again. We have talked about broken bones. We have talked about muscles. We have talked a bit about tendons.
Tendons too.
Now it's time to talk about nerves and how a pinched nerve can affect a lot of your daily activities, and especially if you're an athlete, how it might affect your training as well.
Nerves control everything. They turn the muscles on, they turn the muscles off. If you're an athlete or dancer, high coordination, because some of those sports, they take an unbelievable amount of nerve control, very fine control. Weightlifter has to turn on a lot of nerves quickly. Why? Activate a lot of muscles quickly and get the lift done. Ballet, gymnastics, that's another thing where it's amazingly complicated. So if you screw up a nerve, you're basically screwing up muscle. It won't work right, or it'll misfire, or it'll work at the wrong time. And if you ever actually pinch or stretch a nerve, it'll hurt. It's a lot of times it's a condition called sciatica. It'll hurt in the leg, but really the root of it's in the back. So when a person goes to back surgery, typically it's because their leg hurts so much, not because of back pain. So think of the nerve as command and control, and if you pinch it, one way you might know you have a pinched nerve, pain meds don't touch it. I mean, over the counters. It's just, you take ibuprofens, Tylenols, nothing does anything. And if that's the case, there's an issue beneath it. The conservative treatment for that, I will use chiropractic very carefully, especially if it's a disc, very carefully. Some muscle relief to help the spasms. Acupuncture is a treatment of choice for helping some of the pain relief with back pain, with neck pain, with things that are related to trapped nerves. Sometimes those are big injections, sometimes it's surgical. Then there's a rehab component too. Don't stretch a sciatica though, don't stretch it, because if it's already inflamed, you tug, 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 it can make it actually worse. Having said that, mobility, typically walking is good. There's one condition called stenosis, it's not, but typically keeping the pressure off the nerve. If it's a neck, keeping your head straight, usually. If it's your arm, often above here, kind of takes the stretch and strain off the nerve. It gives you relief, but nerves are difficult and they don't regenerate very well. And that's one of those, if you cut a nerve, maybe stem cell in the future, some cutting edge things, but at this time there's no really good way to regenerate a nerve, so protect those at all costs. On a general note though, nutrition, essential oils, essential omega oils, fatty acids, those are good for nerves, but also making sure you have plenty of vitamin B5/6, these things can help them as well.
Lots of information in a very short period of time, so any questions that you have, remember, jot them down right below, go ahead and ask them. We will see you next time for the last of this series about recovering from injuries, and this time it'll be about torn ligaments.
See you next time.